The Ebola outbreak in the Democratic Republic of Congo, DRC, has now entered a new phase. The health ministry from the DRC says that the first case of Ebola has been confirmed in an urban area. The World Health Organization, who confirmed that the new case has come up in Wangata, a city of nearly 1.2 million people in northwestern DRC. The spread of the virus from the rural areas into a city has raised fears it could quickly spread and become difficult to control. DRC has confirmed that a total of 44 cases of Ebola fever have been reported, including 23 deaths. 3 cases have been confirmed with lab tests. Until now, the cases and deaths were reported from the rural Bikoro health zone, allowing authorities to attempt ring-fencing vaccinations in the affected areas. WHO says that a newly confirmed case in a densely populated part of the country will complicate attempts to control the outbreak.
It's crucial to plan the vaccinations. The targets of the vaccinations are first the health workers, but also those who have been in contact with the confirmed cases, not just alerts or suspected cases. You have to have been in contact with confirmed cases. People who are in contact with a confirmed case will be vaccinated, and those who have been in contact with the contact will be vaccinated as well.
If we see a town of that size infected with Ebola, then we're going to have a major urban outbreak, which is going to be a real challenge in order to respond. As we saw in Ebola West Africa, once Ebola gets into urban areas, especially poor urban slums, it's extremely difficult to get rid of the disease, much more difficult than in isolated rural areas.
The first batch of 4,000 experimental Ebola vaccines to combat an outbreak arrived in Congo's capital, Kinshasa, on Wednesday. The vaccination would start at the weekend, the first time the vaccine would come into use since it was developed 2 years ago. The vaccine is still not licensed but proved effective during limited trials in West Africa and the biggest ever outbreak of Ebola. Ebola has killed 11,300 people in Guinea, Liberia and Sierra Leone between 2014 and 2016. And I'm joined by my colleague Ramesh Ramchandran live from the newsroom. Ramesh, how serious is this outbreak of Ebola virus in an urban area, and does it have the potential to affect other countries outside Africa?
Well, Karthikeya, the outbreak of Ebola is bad in itself, but what we are now seeing is the spread of Ebola from the rural areas to the urban areas. Now, in this particular case in the DRC, we're given to understand that the Ebola virus is spreading from the rural areas to one particular area called Wangata in Mabandaka province town of the DRC. Now, this particular town has a population of 1.2 million, and this is barely 100 kilometers away from the area from where the Ebola virus was first reported, the confirmed cases. So this is the latest challenge facing the government officials there, how to contain the spread of disease from the rural areas to the urban populations. Now, remember, this particular town is in a transportation hub. It's barely a few kilometers away from the capital, Kinshasa. So the spread of disease to the capital city is also there. Now, as you mentioned in the report there, Karthikeya, that already 42 people have been infected with this disease and 23 have died already in the last few weeks. So clearly the threat is immediate and clear and present facing the health officials. And this is the second wave of the outbreak of Ebola. Remember, the first time it happened was in 2014, when, as you mentioned, 11,000 people died. The problem becomes acute, Karthikeya, because there is no available vaccine as of now. The WHO, the World Health Organization, say this is using an experimental vaccine in this particular case in DRC, and they hope that this will help contain the spread of the disease to the urban centers.
But, you know, when you're talking about the new vaccine with a limited trial, and we are talking about a city of 1.2 million people, where already more than a dozen people have been declared Ebola victims. Is it a possibility? Is it a biological? Is it a medical fact that Ebola virus can actually be transported by modern means of transport? Like, for example, the example in case was the bird flu, where the cases started in Southeast Asia, but they got recorded in New Delhi too.
Right. One must understand, Karthikeya, that Ebola is a very infectious disease. It spreads rapidly in many cases that we've already reported. with small amounts of body fluids and passes from animals to humans as well. So this is a very lethal disease, and 50% of those infected with this disease inevitably end up dead. So this is a very clear and present danger for the African countries, especially West Africa, which was the scene of the Ebola epidemic in 2014, when more than 11,000 people had perished in this outbreak. So the challenge before the authorities is to contain the spread of the disease from rural areas to urban centers, especially the capital city Kinshasa, which has millions of people living there. So the immediate challenge is to quarantine, insulate those people there, and not allow it to spread to urban centers or population areas.